Timely data is critical for cancer care. When data is delayed, patients can miss out on receiving critical treatments. A new study shows most hospitals face a 1-year data backlog in oncology, which is really unacceptable. I want to take a moment to thank my surgeon, Dr. Nora Fullington, for giving me the very best experience in my recent hernia surgery. I know that's a funny thing to talk about, but I am truly grateful for her. And this month is really all about gratitude. And along with Dr. Fullington, there's someone else we don't get to thank enough. That's ourselves. It's sometimes hard to remind ourselves that we're trying our best to make sense of everything. And in this crazy world, that really isn't easy. So here's a reminder to send some thanks to the people in your life, including yourself and your surgeon. BetterHelp offers entirely online therapy that's designed to be convenient, flexible, and tailored to fit your schedule. Just fill out a brief questionnaire to get matched with a licensed therapist and switch therapists at any time for no additional charge. It's helpful for learning positive coping skills and how to set boundaries. It empowers you to be the very best version of yourself. So whether you're dealing with stress, anxiety, or simply seeking personal growth, BetterHelp connects you with licensed therapists who can support you on your mental health journey. Let the gratitude flow with BetterHelp. Visit betterhelp.com/CareTalk to get 10% off your first month. That's BetterHelp, HELP.com/CareTalk. Welcome to HealthBiz Briefs. I'm David Williams, president of Health Business Group, here with Karen Schmidt, VP Oncology Market Lead at Q-Centrix, a clinical data company and author of the study. Welcome, Karen.
Thank you, David, for having me today. I appreciate it.
It's a great topic. So I want to hear about, what did your study reveal about data backlogs in oncology, and what kinds of data are we talking about that are delayed?
Yes, Q-Centrix works with over 250 cancer programs across the country. And what we're really finding as we engage with new clients is that they are up to a year behind in their cancer data collection. And it's extremely important because we wonder what patients might have fallen through the cracks for treatment. So it's really an important piece of information to get out there. I think that it's the data that we collect is all about diagnosis, staging, treatment, and even outcomes. And so making sure that this data is current is extremely important to everyone.
So I think nobody wants data, to be delayed for a year. So are there some systemic issues that are driving these delays, and any particular pain points? Sometimes there's like a bottleneck in a process, or anything that comes across from the research.
Yeah, not surprisingly, COVID is one of the main issues. You probably hear this a lot, and why we're seeing a delay in this. The hospitals really had to pull back patient or to support patient care, right? So they pulled back this data collection and really focused these individuals on going to the patients and making sure that they were treated appropriately. So now that we're a couple of years past COVID, we're really starting to see that there's a focus on getting this data caught up.
Karen, you shared with me before we started off that you're a cancer survivor yourself. So put yourself in the patient shoes, which you don't have to do because you're already in them. But
Yeah,
these sort of delays, what could be the impact on a patient?
it's a great question, and it's really important because if a patient is not receiving timely treatments, the outcomes could be different. So, as a cancer survivor, it's really important to me to make sure that we're collecting good data, the physicians have insights into it, and that they understand how treatment needs to be timely, right? So, there are a lot of treatment plans out there that say within 60 days, this patient should have this next treatment. And if we're not collecting the data in a timely manner, that patient could fall through the cracks.
Yeah, I mean that puts it in very personal terms, because the change of outcome is usually not a change for the better.
No,
The
definitely not.
consequences could be very severe. Okay, so you identified the problem, some systemic elements of it, identified how that can impact an individual patient. So what are the recommendations for healthcare leaders and policymakers to do something about these shortcomings? Because on the one hand, it's a big problem. On the other hand, hey, there's a lot of problems in healthcare and they don't all get solved.
Yeah, absolutely. I think that one of the biggest things that we're seeing in the industry right now is that because this backlog is so significant, the states are actually enforcing the laws that are on the books, right? So we're seeing CEOs receive letters saying, "Hey, you're delinquent in this information submission." And we're also hearing about potential hospitals receiving fines for this. So there is action that is happening. I think the broader good is that we have to, put emphasis on this data collection because it's not just important to the historical treatment plans where we can look back and say, when these patients were given this treatment, they had great outcomes. But we need to react to that data in real time and make sure that those patients don't get lost in the transfers or the referrals. That's the biggest thing with cancer. It's not just one physician that takes care of you. It's multiple physicians. It's your oncologist, your radiation oncologist, the pathologist, and all of them have referrals and handoffs that need to be very structured.
Well, that's it for the latest HealthBiz Brief. If you like what you hear, check out my HealthBiz podcast for full-length interviews with healthcare leaders about their lives and careers. Karen Schmidt, VP Oncology Market Lead at Q-Centrix. Thanks for joining me today on HealthBiz Briefs.
Thank you.